My name is Dr. Brian Hooker, and I am a vaccine safety scientist serving as a Chief Scientific Officer of Children's Health Defense. I'm also the father of a severely vaccine-injured adult son. Next slide, please. This slide shows the expansion of the infant-child vaccination schedule since 1962 as recommended by the CDC. Multivalent vaccines are counted based on the number of disease antigens. For example, the MMR vaccine counts as 3 doses. In 1962, children received 5 vaccine doses, and in 1986, the schedule expanded to 25 doses of 5 different vaccine formulations. Shortly after the passage of the 1986 National Childhood Vaccine Injury Act, the law was amended to essentially erect a liability shield protecting vaccine manufacturers, and the schedule expanded dramatically. By 2023, 73 doses of 16 different vaccine formulations were given to children up to age 18. The FDA approved these formulations individually only with minimal and inadequate safety testing, and the CDC has never tested the cumulative effect of the vaccine schedule on childhood health outcomes. However, independent researchers have assessed the outcomes of vaccinated versus unvaccinated children. Next slide, please. This slide shows the results of a paper that Neil Miller, a medical journalist, and I published in the journal Sage Open Medicine in 2020. Here, only vaccines given during the first year of life were considered. Any child who received 1 vaccine or more during the first year of life was considered vaccinated, and any child who received no vaccines during the first year of life was considered unvaccinated. De-identified records were taken directly from 3 medical practices in different locations within the U.S. The odds ratios or likelihood of a diagnosis is shown on the graphic. This demonstrates that vaccinated children were at least twice as likely to be diagnosed with developmental delays, ear infections, and gastrointestinal disorders. The likelihood of an asthma diagnosis among the vaccinated group was 4.5 times higher than the unvaccinated group. Next slide, please. Affirming and extending these results is a study completed by Joy Garner of the control group that was published in the International Journal of Vaccine Theory, Practice, and Research in 2022. Here, a control group of over 1,800 unvaccinated children recruited from 46 different states in the U.S. were compared to the national average rates of the listed disorders. The national averages represent a population of children where 99.7% of the participants are vaccinated. Incidence of each disorder is shown as a percentage of each group of children on the graphic. For each of the autoimmune, neurodevelopmental, and other disorders considered, the unvaccinated group fares much better with incidence rates between 4 and 20 times lower than their vaccinated counterparts. Next slide, please. This is a comparison of the myocarditis diagnosis rates following the COVID-19 mRNA vaccines given during the pandemic. The first graphic on this slide is from a paper published by Mazzari et al. In the journal PLOS Medicine in 2022. It shows the incidence of myocarditis and pericarditis diagnoses within 7 days of receiving either the first or second dose of the Moderna vaccine versus the unvaccinated control group, 4 males between 12 and 39 years of age. The second graphic on the slide is from a paper published by Mavorak et al. In the New England Journal of Medicine in 2021. It shows the incidence of myocarditis within 30 days of receiving the second Pfizer vaccine in the general population, as well as for 16 to 19-year-old boys compared to unvaccinated controls. Myocarditis is a serious disorder, and 76% of all cases following COVID vaccination, as reported by VAERS, requires emergency care and/or hospitalization. CDC significantly downplays myocarditis as a side effect of the vaccine. Vaccine injury is neither minor nor rare. The 1986 National Childhood Vaccine Injury Act requires that the Department of Health and Human Services report to Congress on the state of vaccine safety in the U.S. every 2 years. It's been almost 40 years since the 1986 Act was passed, and HHS has never submitted a vaccine safety report to Congress. federal authorities are derelict in their duty to protect the people of the United States from debilitating and often life-changing vaccine adverse events. Thank you.
Dr. Hooker, I became aware of you from an excellent documentary. I would also recommend Vaxxed that Mr. Bigtree also produced or is part of. In there, you obviously are a medical researcher and with a vaccine in your child, and you actually found a whistleblower inside the agency. But I won't give away the plot of it. But again, very excellent documentary, but difficult to watch.
Right.
Very difficult to watch. But in your research, I mean, are you aware of the fact, do the federal health agencies, do they have records of vaxxed versus unvaxxed children?
Absolutely, they have the records. The CDC has a database called the Vaccine Safety Data Link. It's over 10 million individuals with 2 million children from 10 participating HMOs. There are vaccinated children, there are unvaccinated children. I would say that within that database, there are at least 10,000 unvaccinated children that can be studied.
Do they publish the results of that information?
No, neither do they. They do not publish the results, neither do they let any independent scientist in to look at that information. They refuse to publish that results, and they really know why. It's because the bloated vaccination schedule is responsible and is, I would say, in part responsible for the epidemic of chronic disorders that we see in children in the United States.
So we obviously find that the agencies are completely opaque and uncooperative with congressional oversight.
Right.
It takes a court order, FOIA requests, that type of thing. What types of attempts have been made to obtain that data?
I've submitted over 120 FOIA requests directly to the CDC. There's a 12-step group for me too. But I would say I have repeatedly FOIA'd. I've actually gone through congressional representatives to get the vaccine safety data link itself. It is simply something that they will not do.
So they'd probably say you're just not persistent enough. Mr. McKiernan has a question for you.
Brian, can you explain the finances down there? Do they not sell vaccines at the CDC through a vaccine distribution program? Is there money coming into the CDC for this?
There's a tremendous amount. That's a really good question, Mr. McKernan. And the CDC buys and sells $5 billion worth of vaccines a year through the Vaccines for Children program. They also spend $500 million a year, that's $500 million a year, advertising and through public relationship campaigns for vaccinations in general, as compared to a woeful budget of $50 million that is being used for vaccine safety every year.
Dr. Rick, have you looked at the cost or the risk-benefit ratio of the COVID vaccines in children?
Now, this, to me, there's limited information, and I bowed to Jessica Rose regarding VAERS and her analysis. But when I do the analysis, I see that for every one child that is saved from death from COVID-19, there are 30 child deaths associated with the COVID-19 vaccine. So the risk-to-benefit ratio in terms of mortality is 30 to 1.
The book you co-authored, Vaxxed, Unvaxxed,
right.
Some of those charts are taken from that book. I always hear the statistics of the dramatic increase in chronic diseases throughout our population.
Right.
Do you have a basic statistic on that?
The basic statistics around that, there was a lot of good work done by Joy Garner and the control group. The incidence of chronic illness, individual chronic illness, excluding obesity in the United States, is now 27%. The incidence of multiple chronic disorders in the United States is around 6%. That is compared to a much lower percentage. I don't know the numbers off the top of my head of chronic diseases and disorders in the 1,800 children that they looked at.
So that's a dramatic increase.
Correct.
And I think the question is, why can't we ask about it? What are our federal health agencies doing to research this dramatic increase in chronic diseases?
That's the $64 million question. And you can look at everything besides vaccines to answer that particular question. But you cannot look at vaccines. You're not able to access the vaccine safety data link, which has almost 30 years worth of research from these HMOs, and it should be open to the public.
Yeah, we bought and paid for it. It's what the federal government owes to the American public. Thank you, Dr. Hooker. Our